welcome back. With us live over the phone to talk more about this very important topic is Dr. Islam Anan. He's a professor of pharmacoeconomics and epidemiology. Good morning, Dr. Anan.
Good morning.
How are you doing, sir? So if we could start off talking over, could you please lower the volume of the TV set, please?
There is no TV set, but let me change.
Because there is an echo, I guess.
Is that better?
Yes. Thank you so much. So starting off with an assessment of the role of healthcare for Egypt 25-26 development plan. How do you assess it?
So that's a very good question to start our conversation. So if you are talking about the plan for this year and the second year, we are talking about the budget of the fiscal year that will be set next month. And as President Sisi declared 5 years ago that in our GDP, healthcare should actually represent 3% of our gross domestic product. This year, we are witnessing in the fiscal year the first achievement of the 3%. And as the Prime Minister mentioned, our main focus will be healthcare and education. So we are talking about a budget of 500 billion Egyptian pounds, which is for the first time to be allocated for healthcare, and even higher for education. The tremendous increase, significant increase in the budget represents the main focus of the strategies, the healthcare strategy that Egypt is actually focusing right now to develop human beings. So focusing from human perspective more than just treatment. We do have a lot of axes we are focusing on in the next fiscal year, starting with person-centric care. And by person-centric care, I'm not talking about only treating patients. Another aspect that we've been discussing a lot, which is the infrastructure itself. The new healthcare insurance system, the universal healthcare insurance system, which actually currently covering around 6 million Egyptians, will be expanding for the coming years. We are talking about adding governorates representing more than 3 to 4 million citizens living in it. So we're talking about expanding the infrastructure. We're talking about focusing on human development. We are focusing as well on providing localized medication and healthcare supplies, which is the third aspect of focus for the government, to make sure that we do have a localization in place. We do have our goods and our pharmaceutical needs already represented by local manufacturer. And if we're talking about that, we are 90% of our local needs actually manufactured locally. However, the 10% is actually representing a lot of billions, because these are actually sophisticated, complex products. And currently, there is a plan to have 100% locally manufactured. But even with the local manufacturing, even the input of the manufacturing itself is still imported. So even if we are manufacturing in Egypt, we're still importing raw materials, for example. So another plan was put to make sure that we do have as well raw materials, what we call in pharmaceuticals API, active pharmaceutical ingredients. So having the local input, localization, a good infrastructure, and focusing on the human development, so people were not going to be actually sick, and instead of waiting for them to be with a chronic disease, for example, and then start treating them, are the three main focusing of our 2025-2026 strategy for the next fiscal year.
Right. Today we're talking 700 billion Egyptian pounds allocated for a very important program in the country, which is the human development program, on top of which is the health and education file. My question to you is, how could this bulky amount of money be best invested on health and education, and how relevant are both files to each other?
So let me start with, it's a positive return on investment, because each dollar you are spending on healthcare, if it's allocated correctly, we are expecting a $4 saving in terms of hospitalization, in terms of productivity, and so on. And if we are actually spending this $1 on preventive care, so we are, for example, tackling obesity, anemia, stunting, healthy diet, any public health program which is in a preventive manner, we are expecting a return of investment with a $7. So each dollar spent, we can expect a $7 in savings and return to the economy. Same for education. So when we are talking about tremendous money, allocating a lot of money, we are talking about not allocating money, we're talking about investment. Healthcare and education are actually a good investment, a positive ROI. So this is better allocated in terms of a person-centric, what we were actually talking previously in my previous answer. So why the allocated percentage will be going to human development? Because we do have three objectives for any healthcare system in any country. First of all is to have a good system. Second is to treat patients. And third is to prevent disease from happening. If you are focusing on the third pillar, which is preventing disease from happening, you are ending with a good human development. No successful strategy will be built on waiting for the disease to happen and then start treatment. Thus, I'm saying that the presidential initiatives, for example, the human development group from the ministerial group, are both focusing on the primary prevention of disease. They are focusing on preventing disease, early detection of diseases that can be actually cured or managed. If you are talking, for example, like we've done in hepatitis C, like we've done in women's health, like it's currently going with Sahatak Saada, which is the presidential initiative for psychological and mental health. We are talking about initiatives focusing on being satisfied with your life, being better in your life, with a better productivity. Same for children, for example. Same for pregnant women. The presidential initiatives and the human development for pregnant women and the 1,000 golden days are focusing that we do have a healthy generation. If we cannot satisfy this objective with the current generation, at least we do have a 40-year plan for the newborns of this year and next year, to have a 40-year plan to be happier and healthier, focusing on the first 1,000 days, breastfeeding, to focus that it's actually naturally they are not giving artificial milk a lot. C-section, the cesarean section in Egypt is actually tremendous in terms of percentage, one of the highest worldwide. We need to decrease it versus vaginal birth and normal delivery. And the nutrition, we need to teach mothers how to actually feed their children, what is healthy nutrition versus what's actually bad for their babies, the sugar content, and actually having some regulations for that, like sugar tax, which is putting a lot of taxes on sugary products, for example. Food labeling, making sure that all mothers, they know the calories and they know the label and the artificial ingredients that actually inside any food they are bringing to the children and to the family. All of these are actually preparing the next generation to be healthier and preparing the human development. So if we're talking about budget, it's a good investment. It's a good ROI to be allocated for healthcare and education.
Right. So in what way could the Ministry of Health be able to collaborate with other governments and other private sectors, maybe to be able to implement this very ambitious plan at its best?
It's a multi-sectorial. If we are talking about the people of Egypt, we're not talking about the Ministry of Health only. Ministry of Health can be the orchestrator of the initiative itself. However, as we were saying, you need the Ministry of Education, for example. You are tackling school children. And saying Ministry of Education, there is a very good collaboration between both every year in screening school children versus the obesity, stunting, and anemia. Ministry of Health, they screen 10 million school children at the Ministry of Education every year. So education as well, health education, is very important to make sure that all the teachers and the guardians inside all the hospitals for the children, they understand why you are doing this initiative, why you are screening the children. That's one initiative. Another one is we need the Ministry of Planning. We need the Ministry of Social Solidarity, because we are talking about senior citizens and we're talking about improving health. We are talking about the involvement of the non-governmental organizations. So social solidarity is a very important ministry in terms of collaboration with the Ministry of Health. And having said the non-governmental organizations, the NGOs plays an important role in Egypt in making sure that we do have the solidarity aspect with collaboration with the Ministry of Health in place. There are a lot of diseases that currently being helped with the NGOs. NGOs plays as well a good role in terms of patient association group. They understand patients. They stay a lot of time with them, so they can be a psychological support. They do have good database, and sharing database between the NGOs and the Ministry of Health is one of the biggest collaborative milestones in terms of improvement of the previous answer I was saying, which is the human development. Another aspect in collaboration is the private sector. And the WHO, and there was the assembly of the WHO, the annual assembly last week, and they mentioned that there is no country worldwide can actually succeed in maintaining healthcare and reach financial sustainability if they don't have triple P, public-private partnership. It's the key aspect if I would like to reach the efficiency and financial sustainability. And for that, we need from the private sector a lot of things. We need, for example, technology transfer. We need to make sure that we are helping the government in terms of transferring technology from their country of origin to Egypt in building factories, plants, in having products manufactured in Egypt in terms of localization. Another aspect is to make sure that we do have managed entry agreements, which is the agreement currently the Ministry of Health is doing with the private sector to have a long-term agreement for their product. The main aim is sustainability. We would like to have not a one-year contract. We need to have a long-term contract to make sure that patients got continuous supply. We need to make sure that we do have the early access of products, manage entry agreements, and ensuring that we're not going to be waiting 3 or 4 years for any new products that was launched in the States to be launched in Egypt. In the previous couple of years, we've witnessed a lot of products registered in Egypt before 1 year of the registration in the USA and Europe. And this is a huge achievement, which is actually been there with the collaboration between the public sector and the private sector. Of course, there are a lot of pillars that we can spend hours talking about, but I will finish with another important pillar, which is education. The pharmaceutical sector and the private sector plays an important role as well in terms of education for the patients. They do have as well a database. They do have products being sold in Egypt, and they are in a better position in terms of collaboration with the public health to make sure that they do have budget grants for education to make sure that the patient, they are taking the medication correctly, they know about their disease, there's awareness about the programs running, especially if we're talking about vulnerable population, mothers, pregnant mothers, and people living in rural areas.
Right. People became hopeful hearing this piece of news that there is 700 billion Egyptian pounds allocated for the health program and educational file also as well. But then questions came like there might be some specific areas in the healthcare that could receive the best share or the biggest share of this bulk of money. Or how does it work? I mean, people are very curious because there are some specific areas that really are in dire need for renovation, for upgrade, I mean, pumping money into that section. So how is it going to work?
So the feedback is it was better allocated to something else?
Not something else, but is it officially allocated to specific areas, or how does it work? I mean, or is it according to the request of, I mean, the situations?
Okay, so if we're talking about budget allocation, there is a good strategic matrix for any budget allocation inside the Ministry of Health. So it starts with, do we have actually a need or not for this budget to be spent? For the need itself, it's a very complex way of financial allocation Because, for example, if I'm saying I do have two diseases, I'll just give an example. Which disease should get a higher fund? This is a very important question to any Ministry of Health. And it starts with the epidemiology itself. It starts with, do I have patients or not? So if I have patients, so it means that this area of concern or this disease, it's of a high concern. There is a score for that. If I do have patients and I do have instance of the disease, and then if I do have patients, which is the epidemiology step, there is another step which is the burden. Do patients suffer from that disease or not? They suffer clinically and they suffer economically. And if they do suffer from both, it's another score. So for example, if I'm talking about common cold, maybe patients do exist. We do have millions having common cold every year, but there is a very little clinical burden and a very little economic burden because of common cold. But if I'm talking about cancer, there is a high incidence, a high epidemiology factor, and there is high clinical burden and a high financial burden. Having said that, we do have three indices. Then, if I do have the three, there is a fourth aspect, which is, do I have a treatment or management successful, even globally, not even in Egypt? And if yes, there is another score. And the fourth one, which is a very important and the most complicated one, is the financial sustainability score. Can I actually maintain treating that disease with that management style or not for a long time? If I do have the four scores, we start allocating money. So I was not saying too much technical for the technical part, but just to give the viewer that it's not haphazard allocation. It's with a matrix. It's a complex thing that to say, for example, I will be allocating 7 billion here or 7 billion there. This disease area, for example, is taking a lot of billions because I do have people suffering. I need to treat them. And the financial sustainability, which is the efficiency at the end, I do have even economic return on the country if the people are healthier. And this allocated money will make people more healthy, hence allocated, and hence the productivity of Egypt will increase with that percentage of gross domestic product.
Right. On this note, of course, Dr. Islam Anan, you are a professor of pharmacoeconomics and epidemiology. We'd like to thank you, sir, so much for talking to us on The Breakfast Show. And you have a good day. And we're going to go to a short... You're welcome. A real pleasure. We're going to go to a short break and we'll come to continue The Breakfast Show, so stay with us.